Good afternoon to whoever is watching this video. Welcome to another episode of Accountability Conversation in partnership with Action 8. So today I'm being joined by beautiful ladies. Kalisa always introduce us, starting from
Salibonani Lonke, mina Thubelihle Moyo, ukansela over Ward 17. Ward 17 like Mola North Methodist Robert Nyoba, Mazu St. Peter's, Cllr Ncube, ngokuzalwa ngizalwa ePhilippines.
Salibonani, mina Thubelihle Ncube, lawyer. I work for Transparency International Zimbabwe. Legal advocacy department. Mina originally I'm from Madopo in Sindiso
Salibonani, ibizo lami nguSindiso Dlamini. Ngisebenza ngenhlanganiso ye-Yield Trust and ngisebenza ngingu-Information and Advocacy Officer wabo. Enekhaya ngivela eMpa.
Wow. So today our topic is on gender responsive public expenditure management. So Cindy, this goes to you. How would you define gender responsive public finance management system?
Okay, I think it's a kind of system which focuses on gender kakhulu. Ukuthi you put gender lenses, making sure ukuthi you address all issues that are affecting genders wonke. Normally kungathiwa gender responsive, we think of women kuphela. But in this case, I think we need to include all genders and make sure that our finance management systems they cater for each and every person, for each and every citizen, regardless of their gender.
Okay, can we speak focusing on young lady perspective?
Yeah, that means also young ladies are included when it comes to public finance systems. Ukuthi whenever we are planning, because public finance management system starts with planning. Whenever we are planning, whenever we are drafting our budget or our strategy papers, we need to make sure that young women are included also. They are not just included in the budget, but they are also included in the process of budgeting. They are consulted, they input is for now. As a planner, you don't know everyone, you don't understand everyone. You might be a man, but you are asked to plan a budget. So at the end of the day, you need to include young women to be there in order for them to tell you or as young women, this is what we need budget. And it's also supposed to be guided by a strategy paper, which also needs consultations of so all those systems should include young women, part of each and every process. When the at the end of it all, expenditure to spend the money that you have budgeted for, with then in line with the budget and everything that these young women need.
So do you think that young women are included?
Okay. Partly I would say young women are included. For example, when I look at the processes locally, only budgeting. Young women were called, young women were there. I was also part of those young women. So I would say partly young women are included, but we need more of them. Ukuthi sengathi ngoba sesibona bang 1 2 3 4 5 you say it's enough, no, but we should at least sekujikele lemakhaya we have young women abasemakhaya thina etown siyabe sikhona because sithanda izinto maybe sometimes, and sometimes because we know ukuthi this affects us, but abasemakhaya they don't even understand some of these issues, so they need to be educated in order for them to participate and be involved.
So what's your take when you point that?
I think somehow to say yes, we are involved, young women are involved, we are taking the forefront, that is part of the whole thing, but somehow I feel like the government is not responding to that, or it's not doing enough to make sure that we are actually involved. Yes, maybe we are doing our role and so forth, but good budget, the question is good budget, are they really responding to that? Is there something that speaks into that other than us advocating for it and so forth? What's the government doing about it? I think the question is there, and looking into that somehow, I feel like not much is being done, because if we look at Zimbabwe, yes, we have done, it has taken our steps to try and be a part of this whole equality thing, budget that's not gender blind and so forth. We are signatories, I think, to CEDAW, the Convention on Elimination of Discrimination on Not White Women, but signatory to Beijing platform they are signatories. We set that protocol of gender development and so forth. Even our constitution, I think it's section 54, it speaks of equality. We have sections in 57 that speaks of the need for equal opportunities and what. But then we have all those things, but are those things really being implemented, or we're just signed on paper but nothing's been done about it? So it's really a question of saying, okay, we've done this, but are we really having those things on the ground, or we just have those things on paper?
Cllr Skhu?
Yeah, locally we are doing our best to involve everyone, because gender responsive budgeting is the budget that works for everyone. We try, when we are consulting, siyabiza bonke abantu, siya-targeta all groups as Bulawayo City Council to make sure everybody is involved in participate in the budget, because it's for them, it's for Bulawayo. We involve everyone. The unfortunate part of it is when we go to our government, the section 56 says it out all, but like useswamela kukhulumela ukuthi implementation is bad. Yikho kwenza ukuthi khona kungakhanyi njengoba sifisa ukwenza singubulawayo, because nationally nothing is being implemented. Akula mgoqo echoyo ukuthi nxa singalandela i-constitution kuyakuthini. So it's just a constitution yabhalwayo yabekwa nje, which is not used. Akulandelwa lutho kuyo. Aluba kuyalandelwa from government kusehla phansi bekuzabe kulula kakhulu. But thina as Bulawayo, we make sure we are one of the best council that consult. Siyabiza ontanga bebodwa, siyabiza omama, siyabiza wonke umuntu jikelele. We make sure siyadlala labadala sizwisise indingo zabo ku-budget yabo Bulawayo, ngoba iba abanikazi bakaBulawayo.
So do we have a system in place that deals with gender issues, laws, policies within the council?
Yes, in council we have a gender policy.
In the government?
In government, obviously it's there, but it's only that most of the things are not followed. They are not implemented. But in Bulawayo Council, we are trying to implement everything that we put in on paper, so that we lead by example. In Bulawayo City Council, we have a gender policy where we have even a gender office where issues of gender, where people feel they are not handled properly, where issues of GBV or issues of abuse at work, they have an office where they can report. We have all those issues written down. We have a gender policy in Bulawayo City Council.
So is it working properly for?
Yes, I can say it's working, but there's still a need of advocacy on those lines, because it's a new policy that we are implementing, and very few people are aware and participate kuko. Ngoba isikhathi esiningi vele sithe ukukhula uBulawayo bese sitshela ukuthi khona eminye imithetho khona emsebenzini ngiyokuthi khona ulandele okutshelwayo, but kusasele lendingeko yokuthi i-council layo i-capacitate yama-workers wonke ukwenzela ukuthi babe nolwazi le-policy yakuthi imelele ikhona. Abanye bengabe bengayisebenzisi bengayiboni ukuqakatheka kwayo, but ikhona.
So Tuba, this goes to you. Speaking specifically for young women, what are issues that should be addressed and responded to?
For young women, I think there should be like maybe budget that's allocated towards their empowerment, so that we can be assimilated into a developmental space. We should also advocate for, I think basically when we talk of women, the first thing that comes to mind, the issues of empowerment, development, us working with men and so forth, is the issues around health. Somehow, I feel like women need health care is more risk than guys. Like mainly if you look at maternity, abantu who are getting pregnant are the young ones. Abantu are celebrating, if I can put it that way. We are the ones who are still in that system. But then, if you look at issues like, maybe for example, look at Thubelihle Ncube, currently trending on the newspapers, the issue of this woman who's suing him, which was hospitalized in Harare. Yamanisa made her pay $5 bribe which we attended to when she was already in labor. You know, which pay this first, then we attend to you. Then the whole court case is simple society. A lot of people, there's the other one who died a few months ago together with Babale stillbirth, because somehow they were refusing to attend to her. And so forth. So she died in the hands of our health system and so forth. So we are saying, Guti, as Zimbabwe, we have this, somehow we are claiming to have this budget that speaks into gender issues and but on the ground, it's really not happening. If we really had a budget that looked into those things, those kind of issues would not be happening. Why are we having those women dying in our hospitals? Because Abula maternity care. Seriously, maternity is like it's a serious thing, you know.
Yeah.
But the people are dying, children are dying. What's happening to our future? Because I wonder when are supposed to be the future of Zimbabwe. At the same time, there are issues around maternity leave and so forth. You know, let us come out here. You get this monthly, you be paid at work and so forth. But it's sad. There are some companies that don't even consider that. You are pregnant, you are out, you are born, for those months you don't even get to pay. There should be budget allocations for those kind of things, which maybe there's some form of a maternity allowance or something, you know, because we can't, if we are saying maybe people should stop giving birth altogether, I don't know. But as long as it's there should be things that speak into those things. So we need empowerment, we need maternity health systems that speak into our women, a budget, maybe even a budget, a promoter in girl child education, especially in rural areas. Most of my young girls don't even go to school. It's and just life goes on. So I think those are the kind of things that we need to look into as a country, and the government needs to, you know, simulate that into the strategy and so forth.
Thinking what's your?
Okay, maybe to add on to what Utuba is saying, we are here because of women. So we need to. She's not just an incubator,
okay,
but she's very important.
Yeah.
That's how important women are. Of course, men will say it was an act of two. But still the same, she carried you for 9 months, and in labor process, whatever she went through, they will tell you their stories. Sometimes even end up saying because of the things that is we already fear who gets better because of the stories that they tell you. Instead, that process I'm finally giving birth to a life. But we have to go back and start with sanitary work. 12 years uyangena kuma periods, and each and every month umntwana lana kumele abe le-pad. Khathesi pad, when you go to other shops, akutshela ukuthi ngama-$200, $300 amanye ama-pads, and umuntu has to use ama-pack angu-2 sometimes, and they can't even afford buying that. Ungahamba emakhaya and ask them of the things that they use each and every month, you'll be shocked. Abanye basebenzisa amahlamvu, abanye basebenzisa iziqu, abanye basebenzisa ama-newspaper. And i-newspaper ile ink, ungathela amanzi ku-newspaper, uyabona i-ink lana imuva. What more if it's inside you as a woman? That's the reason why we end up having cervical cancer. Some of these illnesses can be avoided if only our government can consider us whenever they are budgeting. Siyakukhuluma bebe ngihleka nje ukuthi last year ngesikhathi kusenzwa i-budget, I was there, I contributed, and imagazini yabona neyathi kuya e-budget, my name was there. Kukhuluma uSindiso ukhulume ngokuthi we need sanitary subsidies lana. But nxa usukhangela i-budget yangikhona and implementation sesiya ku-2020, it's still not there. What are we saying? Khathesi there is introduction of cups. If just the government can say, okay, we are providing cups, a cup you can use it for 10 years. Make sure that each and every child at school gets a car. You know for the next 10 years they are safe. You don't have to incur the same expense over and over again. Instead, because you are now looking at a smaller number than the number that you initially started with. So those are some of the initiatives that the government is supposed to put in place. How can we then make sure that they get sanitary wear and they stay safe and protected? Because some of the illnesses, after the cancer screening is because of negligence before. And immortality rate, and some women even prefer to at a private hospital. Yet they pay tax. It takes but it gets improper health care. Then at the end of the day, there is no longer social justice. As women, we are suffering because we are paying a lot of taxes. And we are cross-border trading. At the end of the day, they end up thinking of smuggling things. And they are now doing a tax evasion, which is also wrong. Because already, even if they pay tax, they don't benefit out of it. So they now look for other ways than to pay tax and not benefit at the end of the day.
To add what they are saying, singakhangela nje uhlupho esibelalo enyangeni ezidlulileyo kusukela uMarch kusiba le COVID-19. If the government yethu was consulting gender responsive budgeting, I think ibebeza kunanzelela ukuthi khona thina singomama asimi njengoba sinetshilo ubuye esikhathini lama youth yawami ubuye esikhathini. Omama during that COVID-19 bafaka imithetho balibala ukuthi omama babeletha anytime COVID-19 seqalisile. Azange bakuconsulte ukuthi khona kuzahamba njani. Ukuthi umama uzabeletha uzabedobha ngaphi impahla zabantwana zokugqoka, everywhere was closed. It shows ukuthi vele we have a government that does not consider women, and that government just decides ingazange consult because kusukela kuyo phezulu igovernment kubele ukuthi sehle sisenze izinto ezilula siyaphansi. Yona government yethu yodwa vele it has nothing to do with the women nxa sebeplana on emergency. They think for them alone. Ngoba ungakhangela i-COVID-19 time i-lockdown yona leyana kule nhlupho eziningi singabomama ebezilanda omama lamantombazane kakhulu kodwa they were not consulted. You could even tell from the budget itself ukuthi ngakho kumele babekwazi ukuthi kulabo mama abazabeletha during i-lockdown bebekwazi ukuthi omama labana bazafica kulama vesti lokungama-rompa lokungama-nepis, but no one considered that. Omama babeletha ngama-first weeks of lockdown, the challenges ngoba umama isikhathi esiningi sithi kuyasithenga impahla sithenga umntwana sesimole uyakuthengela okuyi-1 but okuningi uthenga umntwana sesimole kuyisintu sethu lokho. But ungakhangela bathi beplana i-COVID-19 bahlala beyi-government. I don't even think they considered there were any women in that meeting that could think online ukuthi alright sithe total lockdown akula muntu emsebenzini, ama-youth labo mama amaphedo nalabo asebenzisa every month sizenzani ngawo, how will they be distributed to them, azabafinyelela njani? You understand? So vele mele kusukele phezulu ku-government konke lokhu kusenzakala kusehla kusiza ku-local government ukuthi kube lula. So there is a lot that our government is not doing. If first they could implement things that are in the constitution, kuzancedisa ukuthi ezinye izinto ze-gender responsive budgeting zilandelelwe sikwazi ukuzenza ngendlela.
Okay, so aspiring back to sikhangele into zakobulawayo khona la, we understand ukuthi when we are planning ezobulawayo asicabangele uma kakhulu ngoba kule issue yama public toilets they are being rented by individuals. Okay, so khona lapha into engibuzayo ukuthi siqalela ngaphi njengobulawayo singela ama public toilet.
Njengobulawayo ibhadalo ama-toilets angikhona esisuke sahlangana lapho kunzima kakhulu njengebulawayo city council okwenze sathi ama-public toilet lana athathwe ngama-private players. Luhlupho lokuthi ukugcinakala kwempahla ka-council, i-council izabe nomuntu oyi-1 okumele akline i-toilet esesitho and i-traffic ngiyabe siya i-toilet yona leyana ukuthi impahla yangikhona igcinakale kugcine sokusibangela ukuthi sinanzelele ukuthi kungavele eminye imikhuhlane and sibe sesibona ukuthi kungangcono uphiwe ama-private players because kwesinye isikhathi indlela singabantu esiphatha ngayo impahla eyabe ngeyethu asiku-prioritize ukuthi ngingangena etoilet epublic ngeyami lami in person ngiyafika ngcolise such that umuntu olandelayo akangena. So kuba nzima khona lapho ngoba ama-cost abe sedingakala, so kumele siqhatshe abantu abaningi ukuyaklina itoilet engalethi lutho, engalethi lemali kubulawayo kule mithi yokuklina edingakalayo. Kulabantu bona ababe besebenza kube kumele bahole. Siyabe sesizabhajeta sithini kubulawayo sesikhulume abantu ukuthi hayi imali eningi iphelela kuma-public toilets asoze bakubone kuyinto engumbono omuhle. Ukuhambisa kuma-private players lokhana ukuncedisana ukuthi khona abantu babekwazi ukuthi hayi ngingakhipha i-5 bond yami liyana kutho ukuthi nisebenzisa ithishu yona liyana engiyitholileyo lokuthi itoilet yona liyana ikliniwe yafakwa o-hand yathelwa domestos yizinto ezithengwayo. Kodwa nxa abantu kuthiwa ngama-public toilets angikwazi ukuthi basuka bakuphathe njani. Ayisiwo wonke ama-public toilets angama-pay toilets, kulamanye achiyiweyo kodwa uthola ukuthi abantu babe bengasafundi kuyafika khona phana ngendlela abawaphatha ngayo. Umlando kuyela kithi thina futhi siyitho mama labosisi labobhuti abanye ukuthi siphatha njani impahla yethu ingeyi-public, siwasebenzisa njani lawo ma-toilet. Okwenza siwayihambise kuma-private players siyabe sidinga ukuthi abantu bangene kuklini ngoba lona umuntu uzawubhadalisa i-5 bond yakhe uzathola ukuthi uyanelisa ukuthi ungene futhi uyakumonitha ukuthi ngicela ukuthi ungangcolisana. Thina siyikhansila umuntu luyani yobe le-routine uzahamba ngo-7 ayiklina itoilet abuyele ngo-12 ayiklina itoilet, but kwesinye isikhathi uthola ukuthi yabe siwonakelelo phana kokuthi kube ungasekho healthy futhi kithi thina esimele siwasebenzise. Yiluhlupho esihlangana layo siyikhansila. Aluba abantu kuyabuyela i-citizenship ukuthi si-one ukuthi khonokho kukhona okungokabulawayo i-public toilet uyigcine njengokuthi uyisebenzisa njani yakho isendlini. Kungaba lula aluba vele ikhansila izange i-engage ukuthi igcine idinga ama-private players phakathi. Njalo kungiyinto engalungisiswa ibuyele nxa abantu sebe-responsible ukuthi bengabakwazi ukuthi ngisiyangena kuleyana itoilet ngizafika ngiyisebenzise ngiyichiye ukuthi omunye olandelayo uzayisebenzisa iklini. Ingazi kumbe ngiyacaca kancane.
Mina for me kuzwakele but bese ngisiba nombuzo futhi ku-council ukuthi do you then do a follow up on ama-private players on allow that to they've been engaged for ama-toilets to make sure ukuthi they've got proper things ezifunakala vele toilet, especially toilet yabomama. Toilet yabomama kumele ibe le-dustbin eproper ukuthi nxa ungafika laphana. I love speaking about SRHR issues ngoba they affect me as a woman kakhulu. Ukuthi nxa ungafika laphana afuna ukutshintsha iphed lakho ukwanisa ukuthi dispose of it properly than ukuthi ungene emnyango uchayisana leminyango umuntu sesweni umthalela hlenga. Abanye bagcine bechiya phezu kwama-system ngoba umuntu ongubaba ngeke angene each and every time. Amanye angikhona they are meant by obaba ngeke angene each and every time efuna ukuyabona ukuthi phakathi kunjani. Lakho nxa isethe wangena achayisana lephed elisemnyango isilingo kuye uyathini kuyanyanyisa kuyayanyisa. So ukuthi at least i-council should do ama-follow-ups and make sure ukuthi those things are there. Amabhinona lawana akhona ukwenzela ukuthi whenever women are coming in ukuthi bazozincedisa lawo bafile safe futhi nxa ichiye lahlile abekwazi angilahle endaweni enjani esafe ongasoze kuyangise futhi nxa omunye umuntu esebuye sizongena khona lapho.
Lokho sibili kungumlando we-council. Ama-inspectors e-health ayalandelela e-check-a ukuthi ama-toilets angikhona ayavumela na ukuthi i-public yanelisa ukuwasebenzisa. Kulesikhathi abasithathayo bayo-check-a bengananzeleli ukuthi akasanelisi bayakwanisa ukuthi bamvalele ngoba uyabe engasalandeli imithetho ye-council ngoba ama-public toilets lana bayalandelela ngoba agcina umphakathi ukuthi wonke umuntu ethe siyafinyelela ukuthi ezinceda ethole kuyindawo esafe eclean engeke umthelele umkhuhlane. Silawo ama-inspectors akwenzayo lokho kungemunye umsebenzi esiwenzayo esibona ukuthi bayakulandelela abakhangeli. And nxa kuyikuthi ungahamba uthole ukuthi kule ndawo lapho engakujabulisanga njalo ulalo ilungelo lokuthi ubuye ku-council or you report to kuma-accounts wethu bo-Facebook kumbe ngapho ukuthi usazise ukuthi endaweni enje ngifice kungamanga kuhle kulilungelo siyakuvumela siyalandelela ngemva kokhona.
I think as a reflection on that, put the issue of free council missing out on public toilets. I think it's a good initiative, and number funds on Alawana that they actually raise from Amaliso and Alawana of having private entities coming through are the funds that can be used to issues on Alawa gender. Those are the funds that can be used to promote the budget that's gender sensitive. Say they can just say the money that we make from Mama Toilets on Kelawa, and so forth and so forth. This money is the money that you're going to use towards maybe getting sanitary wear for high school students and so forth. So I think on their side, it's actually a good initiative. Now the question is those funds that they get after doing that, I'm 8,000 and if they can actually channel them towards sustainable development on gender, what issues, I think that way it would be a very, very excellent project at the end of the day.
I also support what Tuba is saying.
Okay.
At the end of it all, umele at least kube lempumela ecacayo. And xa sikhangele local level in gender responsive budgeting, umele ukuthi each and every time kube le feedback, at least call women, okay, this is what you asked for ekuqaliseni komnyaka when we were budgeting and whatnot. This is what we have done so far. What do you think we can change? Ukuthi kube that reflection, ama evaluations, they are important. Kwenzela ukuthi at the end of it all nxa sesikukhangele sibona ukuthi okay, we had a plan. Iplan yankhona we implemented and these were the results, and ama evaluations, from ama evaluations, this is what we have learned. And this is what we think we can do better, and this is what we think we can then abandon, which we cannot use this because it didn't work for us.
So do you feel like this spending is responsive in Bulawayo?
So far, Bulawayo, we have a lot of issues as affect us women, and especially Katesi. Of course, the water crisis, to a certain extent, it affects indlela omama abaphila ngayo, and it affects them kakhulu. But then we have to consider what it's not all about the money that is within council, but we also look at the water levels and whatnot. Because that means as a woman in a period for 5 days, I have to go and look for water. And on a regular day or my day when I'm having my menses. So all these things affect us as women. And abantu abahlala ezindaweni ezinjengabo country parking ngale abangela vele those sewer systems land. Sometimes kunzima kibo vele when you're looking at those issues that affect women and looking at issues of trade. Abama vendors athengisayo ibudget yethu. Whatever we are planning is we should make sure that our vendors that are women, they are catered for. Like I said earlier on, all mama babathengisayo. Umuntu omfica amatamatisi ehlele street laphana ku 5 Avenue umuntu ongumama. Kukalutshwana oba bebekhona ezidembini yes, but balutshwane when you are comparing the numbers to women and young women. And omunye onkhona ebe lo mntana akhe khona lapha estreetini sangikhona. Umntana egcwele yonke indawo ebamba yonke idoti and all that. And nxa esegula it becomes a burden to the mother. Because Onika care, she's the caregiver and all, and she doesn't get paid for that. So at the end of it all, kumele ukuthi council nxa plan ukuthi okay fine, we're giving stands to abantu abazahamba bayethengisa ibudget yethu silungisa ukuthi silama stands angaka, at least a priority should be given to women because they are the ones abathengisa uqala before sifika kubaba. Ubaba lawo bayenzelwe that ukuthi kube balanced at the end of it all.
I think she's exhausted. I think they can be most of every other thing.
So, Councillor, just speaking as a woman, as a young lady, do you feel like you're responsive in particular expenditure?
As a woman in Bulawayo,
yeah.
I think to be fair enough, ayibonakali lalo bikhansela izama ukuthi bekhona ukhozelwe ukuthi vele wona umkhono mwethu elizwe yomama kahle. Yona ikhansela ilesifiso ilento eziningi ezenzayo to a girl child and a boy child. Kuma SRR programs akhona emalokishini where partners come in employ people that teach children ukuthi nxa besuka ngestage lesi ku-adolescence bahlangana lalokhu yana kwesinye isikhathi uthola ukuthi banikezwa ama-pads and everything. I-counseling yabo ingafisifiso but yona imali yangikhona iyabe ingekho, which needs ukuthi aluba i-economy yethu iyaba right, i-government yethu kube ingenele ithi cushion those areas that affect women. Khathesi ayibonakali awungeke uyifile because ama-challenges ethu singomama amaningi kakhulu. Uchilo uSindi lapho ukhulumile ukuthi khathesi into ehlupha kakhulu sisakhuluma ngamanzi. At least ngibe happy because she appreciates ukuthi ayisikuthi council ayifuna ukuthi kube lamanzi wona vele awekho. But ama-challenges ahlaselo alanda omama abamaningi kakhulu nje bekubekile. So abantu babe bengasacabanga ukuthi council iyabanakekela bengamankazana nabomama kungoba kulohlupho oluqala olwamanzi olugoqelila impilo yethu. Ukugcina sokusithwalisa nzima nje kwethu ukuthi uyaqeda ivini kumele ugeze watshe uthini uspenda more water on that week than any other day. So i-council iyabe kukhangele khona ukhana but ibisikhangela i-government ukuthi i-government yona ithini. Thina sakhuluma singubulawayo sicela ukuthi sideclare ukuthi i-disaster ukuthi kakulamanzi kwathiwa amanzi akhona. So everything embi iyabe sibuya kubulawayo city council but i-government iyabe ikhangele ibona ukuthi into leyo ingayenza kanjani kodwa yenza ibhedeni ibuyele kubulawayo. So mina as a woman I think i-council iyazama kodwa akusithinti sonke asikuboni. But indlela zonke iyazama to prioritize ngoba ningananzelela even lapho amaklinika ethu ayiwo ukubelethelwa khona umama alokhe le standard esinganisingcono ngoba kube iswelo khona phakathi. Ikanti vele mina ngihlala ngisitsho ngithi yonke into ngibisela ku-government. U-government wethu nguyosehlulekayo, nguyohluleka ukuthi asigcine singomama nenkazana ngoba impilo yethu iphelela khonapha. Khathesi singakhangela ngeke ngakhuluma nge-COVID-19 ungakhangela abantwana besikole abazithwalileyo ngesikhathi sona leso ngoba izange ibudget ukuthi aluba yakhe yalethi family planning ukuthi abantwana bonke above 12 just give them ama-tablets so that they prevent.
So as we're closing the show, what are your last words to the public? Ladies first.
Mina engakuchiya kumphakathi kaBulawayo okuqhakatheke kakhulu ukuthi we encourage resident and everyone else to be responsible, pay your bills in time ukwenzela ukuthi uBulawayo anelise kuba nguBulawayo omuhle ole-good service delivery ngoba uBulawayo uba yikhono okuyikho ama-residents. Uma singabhadali sehluleka lokuthi i-city council service yenze imisebenzi yayo. Ngakho ngiyakhuthaza ukuthi let's pay our bills in time ukwenzela ukuthi sigcine uBulawayo wethu emuhle njalo enguBulawayo othuthukileyo. Ngiyabonga.
I think I was that way, but I want to dare the government to live up to the gender responsive government, to the gender responsive budget. Uti they fulfill it, like really have a budget that speak to gender issues, different genders. Ungapongwa into corner on paper that we, like like finance you must ensure that these things are really there because there is no need to see with all these protocols that we have and all these big fancy UN conventions that you are part of, but see anything about it. So the body Ministry of Finance so I think for me that's the whole thing.
Alright, my last words would be women should be included in each and every process and in each and every stage. Banga include everything ngale ngaso evaluate ukuthi hayi sisebenze njani but bengazange babe khona ukuthi bathi input ekusebenzeni kwakhona. And also ekuthini whenever we are budgeting make sure ukuthi even the Ministry of Women Affairs lawo iyathola at least a little bit of money in order for it to function incedise omama bakhona ku community. Lokuthi also nxa befaka kuma assistance abo ukuthi sifake lo mama ukuthi bakwazi ukuhamba bayithatha bethatha ama loans ema-bank in their businesses and what not. But consider futhi ukuthi we have young women esingelazi indlu esingela collateral, but we still need to access that because it's within gender responsive budgeting. If kufakiwe a system but we don't have access, at the end of the day it's useless. So at least as young women we need to be included in everything, and we also need to have access to everything too.
Siyabonga wena closing our show, so sacela uthiwa ahlabelele ingoma echechi eyi.
Ukabonwanga